Today we're going to talk about genital herpes, what causes it, what its symptoms are, and what solutions are available. Genital herpes is an infection of the genitals, buttocks, or anal area caused by herpes simplex virus or HSV. This virus affects the genitals, the cervix, as well as the skin in other parts of the body. There are two types of herpes simplex viruses. A is HSV1 or herpes type 1, and B, HSV2 or herpes type 2. Most genital herpes is caused by HSV type 2 and is easily human transmissible. It is passed from one person to another by close, direct contact. The most common mode of transmission is through vaginal, anal, or oral sex. Occasionally, it can cause sores in the mouth and can be spread by secretions and saliva because the virus does not live outside of the body for long. You cannot catch genital herpes from an object such as toilet seat. Most people who are infected with HSV do not know it because their symptoms are so slight. Many people have no discernible symptoms. The CDC estimates that annually 776,000 people in the United States get new herpes infections. Genital herpes infection is common in the United States. Nationwide, 16% or about 1 out of 6 people aged 14 to 49 years have genital HSV2 infection. Over the past decade, the percentage of persons with genital herpes infection in the United States has remained stable. The overall prevalence of genital herpes is likely higher than 16.2% because an increasing number of genital herpes infections are caused by HSV1. Increases in genital HSV1 infections have been found in patient population worldwide. Most individuals infected with HSV1 or HSV2 are asymptomatic or have very mild symptoms that go unnoticed or are mistaken for another skin condition. As a result, over 80% of infected individuals remain unaware of their infection. However, if a person does have an outbreak, the symptoms can cause significant discomfort. Someone with genital herpes may first notice itching or pain, followed by sores that appear a few hours or a few days later. The sores, which may appear on the vagina, penis, scrotum, buttocks, or anus, start out as red bumps that soon turn into red, watery blisters. The sores might make it very painful to urinate. The sores may open up, ooze fluid, or bleed. During a first herpes outbreak, they can take from a week to several weeks to heal. The entire genital area may feel very tender or painful, and the person may have flu-like symptoms including fever, headache, and swollen lymph nodes. Although the infection can stay in the body indefinitely, the number of outbreaks tend to decrease over time. Recurrences are much less frequent for genital HSV1 infections than for genital HSV2 infection. If future outbreaks occur, they tend to be less severe and shorter in duration, with sores healing faster. It is generally believed that at present there is no way to completely eradicate the HSV from our system. The virus will remain dormant in the body and can reappear at any time. Antiviral medication can, however, prevent or shorten outbreaks during the period of time the person takes the medication. In addition, daily use of antiviral medication for herpes can reduce the likelihood of transmission to partners. Unfortunately, these treatments have their side effects and are inevitably costly. Aside from the well-known conventional treatments, there are some complementary homeopathic treatments that are known to be quite effective. Herbs such as echinacea can help grant relief from different herpes symptoms. Baking soda aids in drying out moisture from oozing lesions, thus making the blisters disappear sooner. Lysine, which is an essential amino acid, may also be used to prevent an outbreak by blocking arginine that plays an important role in the replication of herpes virus. Lastly, if you want to find relief from the burning sensation and manage flare-ups, try using a cool tea bag or a reputed brand of aloe vera cream. These homeopathic treatments are holistic and comprehensive in nature, and they do not carry the same side effects and economical costs associated with taking antiviral medication on a daily basis. While it's common knowledge that HSV1 and 2 can cause serious complications such as blindness, encephalitis, and aseptic meningitis, what's often overlooked is that the fact that people who contract genital herpes have concerns about how it will impact their sex life and relationship. There can be considerable embarrassment, shame, and stigma associated with a herpes diagnosis, and this can substantially interfere with a patient's relationships.